All right. Well, my name is Joey McCluskey. I work for CCIG. We're the insurance broker for Buehler Company. What that means is I don't represent Cigna or any of the carriers per se. We're here to advocate for you guys. You are our client. We survey the market, make sure that you guys are getting the best rates with the best company, and making sure that you guys are all happy as well as the employer's happy. That way, everyone is a win-win. This is the time for open enrollment, so that's what this packet is. It's just kind of a high-level overview of all the plans. If you would like the full benefit summaries of any of the plans that are in here, we have those available. They should be on the Paycom website whenever you're making elections. There's benefit summaries, I believe. If for some reason you're unable to find that, please let me know, or let Amy know, let Stuart know, let Garrett, one of the Garys know. We're here to help you. We can get those for you. Just for the sake of everyone's sanity, for the sake of time, I'm only going to go through this packet here. The full benefit summaries for each plan is about 8 to 10 pages long, so don't want to put you to sleep. I know the first thing you want to talk about at 6:30 in the morning is insurance, right? So everything that you see in this packet, elections that you make, will go into effect February 1st. So even though we're having this meeting a little bit early in January, anything that you make change-wise is not going to go into effect until February 1st. So let's say that you're adding a child to your plan that wasn't on there before. When you make your election, it doesn't go into effect right then. It's not until the 1st of February. Does that make sense to everyone? Elections that you do make will be locked in from February 2019 all the way through the end of January of 2020. You cannot make changes to your plans throughout the year without what's called an IRS qualifying event. A couple of examples are listed on page 3 of that guide of qualifying events. It's regulated by the IRS. These are things like if I get married, I need to add a spouse to the plan. I've got 30 days to notify my employer of that change. That way you can get that spouse added. If you have a child in the middle of the plan year, you need to add that child. Again, you have 30 days after a qualifying event to add that dependent or drop a dependent from the plan if that's what needs to happen. Other examples of qualifying events, let's say that you have a spouse that's on another group policy from her insurer or her company, and they're going through open enrollment. She wants to jump over to the Buehler plan. That would be a gain of other group coverage. That's considered a qualifying event. Does that make sense to everyone? I cannot make changes in the plan year without a qualifying event. So that's very, very important. So make sure that you're making an educated decision on what plan works best for you and your family. The reason that we have 3 plans that are offered medical-wise is because we know that not one plan works well for every family in every situation. So we want to give you, an option to pick what's going to work best for you. As we go through on page 4, this is what's new. Honestly, not much is new. The same plans are being offered. All 3 medical plans are the exact same as they were last year. So this is really just going to be a review. Dental, vision, your life and accidental death and dismemberment. Supplemental insurance is provided through Colonial. And then you have an FSA option and an HSA option that I'm going to discuss. But no changes to the plans. The only slight change is to the premiums, which you guys already all found that page. The premiums went up about 10%. So it's not a huge hit if you're an employee. It's about $6 a paycheck for that base level plan. It's about $12 a month. It's not completely drastic, but again, I'll kind of talk about some of the things that we can do in the future to keep those premiums low as I go through these plans. So I'm going to go on page 7 of that guide. Your medical insurance is through Cigna. Cigna is one of the top carriers in the DFW market as well as the Colorado market. That's one of the reasons that we are with Cigna. There's 3 options like I was talking about. There's 2 different networks within those 3 options. There is a local plus network and an open access network. Difference between those is a local plus is going to be a little bit narrower of a network, so not as many options for providers. The open access plus is going to be your broad national Cigna network, so it's going to be very difficult to find someone who's out of network there, but I'll talk about how there's actually no out of network benefits on that plan. You have a lot more providers to choose from on that if you would like to buy up to that option. So I'm actually going to start off on option 3. That's the open access plus that I'm talking about. So this would be the plan that Cigna employees, this is the network that they use. It's a national network with Cigna. Like I said, tough to find an out-of-network provider, but I would always encourage you to research. If you have not already, there is a mycigna.com. You can register, have a login. It's pretty slick. It shows you what deductible has been met, any out-of-pocket that you've met. You can pull explanation of benefits so you can make sure that you're being billed properly. I would not pay any bills from a provider until I look at an EOB, an explanation of benefits, and verify that they're billing me correctly. If you guys do have any issues with billing, that's what we're here for. We're here to advocate for you. It's going to always be best to try to go through Cigna first. There's a member number on the back of your ID card. Try calling that first, but if they're unable to help you or not getting the answers that you're looking for, please let us know, because that's what we're here for. We want to jump in and make sure that you're getting the help that you deserve. So with that said, on the Open Access Plus, this is going to be your traditional copay plan. So what most of you would be used to. With copays, with the office visits, so your primary care physician, family doctors, there's going to be copays that are associated with those visits. The way that this plan works, if you're looking at the top, there's a deductible that's listed there. It's a $1,000 deductible for an individual and a $3,000 deductible for a family. That is an embedded deductible. And so what that means is if you do have a family, once each individual person satisfies the individual deductible, the coinsurance comes into effect for that person. And so what does that mean? If I've got myself, my spouse, and a child on the plan, my child breaks his arm, goes to the emergency room, racks up $1,000 worth of services, so 70% coinsurance is going to come into play for my child. I then have my spouse break her arm. She goes to the emergency room, racks up $1,000 worth of services. Coinsurance would kick in for her. My family's got weak bones. I break my arm. I go to the emergency room. Coinsurance comes into effect for me. If you have another child on that plan, they go to get services done. We've already hit that $3,000 family deductible, so the current coinsurance would already come into play for that 4th person. Does that make sense how that works? So basically each individual person has that $1,000 deductible, but it'll cap out at $3,000 for the family. So it benefits families of 4 or more. Does that make sense how that works? And so you hear me talking about coinsurance. That's the 3rd item that's listed there. It's 70% on this plan. That means that Cigna picks up 70% after the deductible, and you would be responsible for the additional 30% for things that are subject to that deductible. You would pay 30% after the deductible up to your out-of-pocket maximum, which is listed underneath there. It's $4,000 for an individual and $12,000 for a family. That again is that embedded out-of-pocket. So once each individual person satisfies that $4,000 out-of-pocket, any covered service is covered at 100% for that person. And it'll cap out at $12,000 for the family. Things that are subject to that $1,000 deductible are the things listed below as 70% after medical deductible. So things like your inpatient hospitalization services, advanced imaging, those are things that are going to be subject to that $1,000 deductible. Things that are not subject to that deductible are your copays. So if you're looking down here at the office visits about midway down, That's your primary care physician, family doctor. When I go into a facility like that, there's a $30 copay that's available to you. That's from day one. There's nothing deductible-wise that you have to hit before you pay that copay. So if you're on this plan, go to the doctor February 2nd, there's going to be a $30 copay associated with that office visit. If I need to go see a specialist, there's a $50 copay. You do not need a referral on this plan, and you don't have to have a designated primary care physician. So it's not like an HMO that some of you might have heard of, where they require you to have a doctor that you always go to, and that doctor has to refer you to specialists if you need that. This plan is not like that. You have the option to go to whatever provider that you would like. I would always make sure it's in-network, and I'll talk about that in just a moment. Lab and x-ray, that's listed as 100% deductible, does not apply. What that means is if I go to the doctor, they have to do some lab x-ray work, that's included in that $30 office visit copay. So if I have any lab x-ray work during that visit, it's going to be included. If it's not for some reason, please let us know so we can make sure that we get with Cigna and make sure that's being billed properly. Urgent care actually matches that specialist copay. So if it's a weekend, you're unable to get into the doctor, need to go to an urgent care facility, it's the same copay as that specialist visit of $50. If I need to go to the emergency room, it's a $400 copay. And then lastly, your prescription drugs. There's a small deductible on the prescription drugs that's separate from that medical deductible. The prescription drugs has a $150 individual deductible and a $300 family deductible. After that $150 or $300 deductible has been met, you have copays. It's a 4-tiered system. They've kind of shied away from using generic, preferred, non-preferred brand name when they're labeling their prescription drug plans. They just call it Tier 1 through Tier 4. So your Tier 1 medications is $15 copay, Tier 2, $50, Tier 3, $70, and Tier 4, which is like specialty medications, is $100 copay. The reason that they do that is there's some brand name drugs that could fall under a Tier 1 copay that aren't necessarily generic drugs, but the cost of that drug is very cheap, so they label it as a Tier 1. So that's kind of why they've shied away from labeling it as that generic versus preferred versus non-preferred brand name, etc. Does that make sense to everyone, how that runs? So just a brief kind of recap. I've got things that are subject to that deductible. So my inpatient hospitalization, things of that nature are going towards that $1,000 deductible. Once that $1,000 deductible has been met, all of those things that were subject before, the inpatient hospitalization, etc., are going to be covered at 70% by Cigna, and you would be responsible for 30% up to the out-of-pocket maximum of $4,000. That's just for an individual. After the out-of-pocket has been met, that is a true out-of-pocket, so that means that's the most you're going to pay on that plan. That's it, out-of-pocket. So if I hit $4,000 as an individual, anything that's a covered service is going to be covered at 100% on this plan. So it's a true out-of-pocket. One thing that's very, very important, if you'll notice on the out-of-network column, it says not covered. There is no out-of-network benefits on this plan. If you're utilizing a provider, make sure it is an in-network provider or there's not going to be any coverage for you. The only way that you get coverage for an out-of-network provider is if it's a true emergencies, that's life or limb altering. So if you're injured, need to go in an ambulance, they take you to an out-of-network hospital, they're going to bill that as in-network if it's a true emergency. Does that make sense to everyone? So whenever I'm talking about not being covered, it's things that are elective. So I need to go get knee surgery. I schedule surgery with a physician that's out of network. There's not going to be coverage for that surgery. So very, very important. Utilize the mycigna.com. There's a find a provider on there. Search that Open Access Plus network and make sure that the providers that you're seeing are in that network. Does that make sense?
I got a claim form and my insurance provider, they sent me a check for what I had to pay out of network. I could use out of network.
So on the other two plans, there is out-of-network benefits, and that might be what you're referring to. So I'm going to go into that right now. So options 1 and 2 are called HSA eligible plans, or they're high deductible health plans. So I'll kind of talk about the benefits of an HSA, but I want to go over the core of the plan first. So option 1, that's your base plan. That's what the contribution is based off of. This works a little bit differently than that option 3, and that's kind of why I went over option 3 first. So in order to be HSA eligible, and like I said, I'll talk about what that means, the IRS regulates that and says a couple things must occur. It has to be a high deductible health plan, which we've done here, and there could be no first dollar benefit. And so that means there's no copays on this plan. So what does that look like when I go to the doctor? When I go to a primary care physician, family doctor, specialist, emergency room, urgent care, any of those providers, you're going to pay the negotiated rate between Cigna and whoever that provider is. Okay? So it's not going to be completely unattainable. To give you an example of cost, this is just an arbitrary number, but something I've seen before on an HSA plan. Doctor's visit could range anywhere from $60 to $100. And that's kind of the idea behind these, is that if you're looking at that premium page, you're saving a lot of cost by having this plan. So you're able to promote consumerism, and you guys as consumers can go and shop around for those providers. Make sure that you're getting the most bang for your buck. So that's why I say utilize that Cigna.com. You can actually search for providers. There should be a cost estimator on there. So you can actually look at the different providers and it'll estimate how much that visit would cost you. So all of the services that had copays on that option 3, there's not copays on these two plans, these first two plans. So I go to the doctor, let's say it's a $72 visit. I'm going to be responsible for that $72. The deductible on this plan, everything is accumulating towards that deductible. So the deductible for an individual is $6,350, and the deductible for a family is $12,700. So the deductible on this plan is only 2 times that individual deductible, the family deductible. So this actually benefits families of 3 or more, because it's an embedded deductible like that option 3, where once each individual person satisfies the $6,350, coinsurance applies for that person. Now, if you'll notice on this plan, the coinsurance is a little bit richer. So it's 100% after the deductible has been met. What that means is the out-of-pocket matches that deductible. So everything's accumulating towards that deductible, all the services that you have. If I go to a specialist, if I go to a doctor's office, urgent care, emergency room, all of that's accumulating towards your $6,350 individual deductible. Once that deductible has been satisfied, you've met your out-of-pocket maximum, and every service that's covered is covered at 100%. Does that make sense to everyone? On the option 2, very similar. The only difference is everything's accumulating towards that deductible, including your prescription drugs. It's a negotiated rate between Cigna and whoever that pharmacy is or whoever that provider is until that deductible has been met. And I'm talking about option 2 here. Once the deductible has been met, everything that was a covered service is covered at 100%. The only thing that you're responsible for paying after the deductible on this option 2 is prescription drugs. So after the $3,000 deductible for an individual or $6,000 for a family has been satisfied, you're going to have copays on your prescription drugs. It's the same copays that are on that option 3. But prior to that deductible, it's going to be a negotiated rate between the pharmacy and Cigna. So if you have a high cost medication, you're going to pay the negotiated rate, the cost of that medication up to that deductible, and then you would have your copays kick in. Does that make sense to everyone? So the last thing that I want to cover is about the 5th line item down. This is very important. If you hear nothing else, hear this. Your wellness preventive care is covered at 100%. There's no deductible, there's no copay that applies to that. Wellness preventive care are things like your annual physicals, well woman exams. If you have children on the plan, well baby exams, all the immunizations, monthly checkups that are required by law, those are all covered at 100% from day one. There's nothing that you have to pay out of your pocket before that's covered at 100%. Everyone needs to be getting an annual physical. If you're not doing that right now, there's no reason not to do that. It's covered 100%. You're paying the premiums for the plan. Take advantage of that free visit. Go get an annual physical. One of the things that we discussed with Stuart and Gary and everyone, the premiums went up, and that's largely dependent upon the utilization of this plan. So as you're utilizing it, the claims continue to rise. We want you to take care of yourselves. If everyone's taking care of themselves, that causes the premiums to either stay flat or even go down in the future. So we want to make sure that we're getting ourselves checked out, making sure that we're preventing things from happening in the future, right? I go get my annual physical, they catch something early, that's a win-win for everyone. We can address that before it's catastrophic. So make sure that you're taking care of yourself and utilizing that free physical. Everyone should be getting a physical in the month of February. Can we all promise to do that? Yeah? Come on. The Saints hat, it's free. How are your Saints doing? They're pretty good. Garbage. How about them Cowboys?
Yeah.
So like I said, it's the premiums that you're paying are all really dependent upon the utilization of the plan. So make sure that you're taking care of yourself. The other thing that I would urge you to do if you're on one of the, if you're on any plan really, but especially if you're on one of the first two plans where it's all the negotiated rate, be very mindful of urgent care versus emergency room. It's a huge cost differential between those two services, right? So you see those freestanding emergency rooms popping up all over the place. Texas is one of the leading states in those. Be very, very mindful when you're going into a facility like that. Just being in this industry for a long time, I've heard some horror stories about that. So I've heard, you went in the front door, it's an urgent care, but if you go in the back door, it's an emergency room. If you would have gotten here before 5 o'clock, we would have billed it as an urgent care. But since you got here after, we're billing it as an emergency room. So as consumers, unfortunately, it's fallen on your lap to ask those questions. If you're going into a freestanding emergency room, urgent care center, etc., make sure that you're asking the question, how are you going to bill this? Are you going to bill it as an urgent care, or are you going to bill it as an emergency room? They are required by law to answer that question. If it is not a true emergency and they're going to bill it as an emergency room, get out of there as quick as you can and go find either true urgent care, or if it's something that can wait to go see your primary care physician. You should always try to funnel things through your primary care physician. It's going to be the cheapest route for you and the most bang for your buck. If they need to send you off to a specialist, they can do that from the doctor's office, right? And like I said, you don't have to have a referral, but always ask for that referral. If you don't want to use that specialist that your primary care physician is suggesting, you have the option to choose any specialist that you'd like. And you can utilize that mycigna.com to get those cost estimators to see how much you might pay for those visits. Does that kind of hit home for everyone? Does that make sense how all these plans run? Are there any questions over the bulk of these plans and how they run? Like I said, it's the same plans that were offered last year. So it should just kind of be a recap for you on how the insurance works.
Isn't there a savings you can put into?
There is, and I'm going to talk about that.
But if you don't use it in that year, they say you lose it.
So there's two different things that are offered. So that's actually, I'll talk about that next. So I'm going to skip a few pages to page 11. So if you're on the option 3, that copay plan, you're not eligible for a health savings account. You're eligible for a flexible spending or an FSA account. And that's the option 3 plan only. A flexible spending account is a tax advantage account. What that means is if I know I have $1,000 worth of expenses that I'm going to pay for the year, I can elect $1,000 and they'll actually send me a debit card that's loaded up with that $1,000. You'll pay for that $1,000 through payroll deductions throughout the year, but that $1,000 is going to be available from day one whenever you get that debit card, effective February 1st. So I can use that money on qualified medical expenses. The IRS regulates that. If you go to the IRS website, you can look up qualified medical expenses for an FSA and for an HSA. There's a number of things that are on there that a lot of people don't think of. I've gotten contact solution with it. You can use it on your dental services, your medical services, your vision services. There's also an FSA store. It's fsastore.com. Everything that's on that website is FSA eligible. So you don't have any issues with finding things that are eligible on that site. The IRS does put a maximum on the amount that you can set aside, or the amount that you can have on that FSA card, and it's $2,700 for 2019. So the most that I can set aside or pay throughout the year is $2,700. If I elect that $2,700, they're going to give me a debit card that's got $2,700 loaded on there. With an FSA, at the end of the year, that money goes away if you have not used it. And so that's one of the reasons I mentioned the fsastore.com. If you find yourself at the end of the year and you've still got $100 in that account, go to that fsastore.com and start swiping away, all right? Because that money will go away if you do not use it.
So they take out, say if you elected the 2,700 throughout the year, they take out 2,700.
Correct. It would be, if you guys are 26 pay periods, it would be 2,700 divided by 26. That's how much per pay period you would pay. If you do not use those funds, they go away. When they're deducting that out, it's deducted pre-tax. So you're actually reducing your taxable income if you're choosing to use this FSA. So you never pay tax on those dollars. So it is a good benefit if you have expenses that you know of, or if you're thinking that something might come up, you've got a surgery that's going to cost you X amount, you can go ahead and set that money aside into the FSA. You can already have it available so you can swipe it and you don't pay tax on those dollars. So I always tell people, if you have a routine medication, you know it's going to be $50 a month, go ahead and set $50 a month into that FSA. That way I could save the tax dollars on that, right? The other option that you have is a dependent care FSA. So if you have children that are in daycare, you know you're going to pay those daycare expenses, you can set up to $5 aside into that FSA for those childcare expenses. Okay? That's two separate things. So you have your medical expenses, the maximum is $2,700, and then you have your dependent care, which is for things like daycare. You can set up to $5,000. Does that make sense on the FSA? It is a use it or lose it plan you're talking about. The other option that you have, which is on page 13, is a health savings account. This coincides with those option 1 and option 2 medical plans. And so that's what I was talking about, an HSA eligible plan. You would be eligible for a health savings account. This is also a tax advantage savings account. If I choose that I want $1,200 a year going into that account, they're going to deduct $100 a month from my paycheck. It's going to be deducted pre-tax. So I'm saving the tax money on that. I'm reducing my taxable income. That's less money I got to send to Uncle Sam at the end of the year. Right? If I know I have expenses, go ahead and set that money aside into a health savings account. The reason that this is a beneficial plan is the premiums on those first two plans are a lot less than that third plan. So the idea is, since I'm saving money on those premiums, I know I'm going to have negotiated office visits, the cost of those office visits and services. So I can set money aside into that health savings account, and it's tax-free. So then when I do have to go to the doctor, I can rest easy because I've already got that money set aside. The benefit of an HSA versus an FSA is that that money does not go away at the end of the year. So if I'm on an HSA plan and I'm contributing into my HSA account, that money continues to build up year after year. So if I set $1,200 aside, I pay $100 a month into that health savings account. I only use $200 of it throughout the year. I've got $1,000 for next year that I can spend, right? So it'll continue to build year after year. This is not a use it or lose it like that FSA is. Once you have, depending on the bank, once you have a certain amount of funds in that health savings account, you can actually start investing that money in the market and build interest off of that, right? So a couple of it's kind of a triple threat with tax advantage savings on the HSA. So I've got money that's coming into that account pre-tax. As I use that money on qualified medical, dental, and vision expenses, it's coming out of that account pre-tax. And as that money sits in there, if I'm not using it, works just like a regular savings account with your bank. It's going to grow a small interest based off of the funds that are in there. So that interest is being raised pre-tax.
You know the interest rate?
I don't know the interest rate, but I can look at it. It's going to be like your regular savings account. So it's a very, very minimal. But if you do keep that, year after year, and that amount continues to grow, the more interest you're going to get off of that. But that money does not go away. I have an uncle who was on an HSA eligible plan and contributed to an HSA for about 30 years. I think he had, I don't know, somewhere along the lines of like 20 grand in that account. He actually got diagnosed with cancer, was able to use those funds for that cancer treatment. So it's really, really beneficial to set money aside. Even if you're setting, $20 a paycheck in there, $10 a paycheck, just contribute something in there. That way, if you do have to go to the doctor, you can just swipe that card, not even really think about it, right? Does that make sense to everyone, how an FSA differs from an HSA? Difference between those? I know it seems like I'm going a little slow, but I like to make sure everyone understands. So those are your options for medical. So I've got the 3 medical plans. I've got an option for an FSA if I'm choosing that option 3 medical plan. And I've got an option for an HSA if I'm choosing 1 or 2 on the medical plans. You do not have to use an FSA or an HSA. If you're on an HSA plan, you can just be on that plan and pay for those expenses as they come up. You don't have to use an HSA. But like I said, I would always encourage you to do that just for the tax advantage savings on there. I know I'm going to spend money anyways. I might as well save tax dollars on it. So any more questions on medical? All right. I'm going to go jump back. Sorry, guys. I'm kind of jumping around to page 5. This is what everyone wanted to see. This is the premium page. It shows you the full monthly premium, the very generous contribution by Buehler, and then your cost. So the cost did increase about 10%. That equates on the base plan, so that base level HSA plan, to about $6 a paycheck. So it's not.
Did you say it increased from last year?
It did increase from last year, right? And so that's one of the reasons I'm, really pushing for that wellness visits. Make sure you're taking care of yourself, because these premiums are largely dependent upon the utilization of the plan. If the plan has really, really high claims, everyone's going to the doctor a whole lot, they're all sick, the premiums are going to increase based off of that. So if we're making sure that we're taking care of ourselves, catching things early, getting an annual physical, that can reduce those claims costs and in turn reduce your premium costs that you're paying, or keep them flat or what have you. So make sure that you're taking care of yourselves. You're going to see some changes happening with that. We're going to start some wellness initiatives. Look for flyers on bulletin boards, emails out to you, once a month or so, just kind of talking about some wellness things. I believe we're going to try to implement some fruit in the office, etc. So a lot of changes with wellness and making sure that we're really taking care of ourselves and utilizing the benefits to its full potential. So any questions over medical? I'll kind of quickly go over the dental and vision. I just wanted to make sure we really focused on the medical and got a good grasp of how that works. Is everyone good on that? Okay, cool. What's that? So dental is also through Cigna. It's going to be the DPPO Advantage Network. So that's listed on your benefit guide there on page 8. If I'm searching for a dentist and I want to use an in-network dentist, which I always do, right? I'm going to search the Dental PPO or DPPO Advantage Network with Cigna. The way that this dental plan works, I've got $1,000 annual maximum. That is per covered individual. So if I've got myself, my spouse, and 3 kids on the plan, everybody gets $1,000 from Cigna for dental benefits. My preventive services, my annual cleanings, I get 2 annual cleanings. That includes your bite wing x-rays, fluoride treatments, etc. That annual preventive visit is covered at 100%. There's nothing you have to pay before that's covered at 100%. They see a cavity that they need to fill. They bring you in for a basic routine service. There's a small deductible that has to be met prior to that basic service co-insurance coming into play. It's $50 for an individual and $150 for a family. So I go get my free annual cleaning 2 times a year. They bring me in for a basic service. I've got a $50 deductible as an individual, and then those basic services are covered at 80%. So you would be responsible for 20%, Cigna would pay 80%. Then they say, that filling's not working out. We need to put a crown on you. That's going to be a major service. Major services after that deductible, you won't have to pay it again. So if you already paid it for a basic service, you've already hit your deductible. But after the deductible, your major services are covered at 50%. If you have kiddos on the plan, there is a child ortho benefit that's at the bottom there. Child ortho is covered at 50% up to a maximum of $1,000 per child. The difference between the annual maximum, the $1,000, and your $1,000 ortho benefit is the ortho benefit is a lifetime maximum. So only get that one time per child, whereas your annual maximum resets every January. So even though our plan is renewing in February and changes aren't going into effect until February, on dental, your annual maximum resets every January. Okay? So if you haven't utilized your benefits for the year, go ahead and utilize those. So everyone understand how that dental plan runs? Okay. Vision plan on page 9. The way that the vision plan works, it's also through Cigna. You can jump on mycigna.com, find a vision provider that's in network. When I go in for an eye exam, there's going to be a $20 copay for that eye exam. After that eye exam, let's say that I want to get glasses. I pay a $20 material copay. That's going to cover single corrective lenses. So $40 total, your $20 exam and your $20 material copay, that's going to cover a pair of single corrective lenses. If they want to give you all the fixings, the anti-scratch, anti-glare, ultra-thin lenses, there's additional copays that are associated with that. Look at the full benefit summary to get those copays. But that's kind of how the vision providers get you, is they'll start adding on all those different features for your lenses, and your copays continue to add up there. So $40 total, $20 eye exam, $20 material, and you've got single corrective lenses that are covered at 100%. So if they are adding those things, make sure you're getting an itemized receipt to make sure that they're charging you properly for additional add-ons. Once I get my lenses, they send me out to the gallery to pick a pair of frames. I've got $130 allowance towards those frames. Let's say that you have a $200 pair of frames, $130 is coming off from your allowance, and then you still get a 20% discount on that additional amount over the 130. You'll notice it says that the frequency is every 24 months for these. So every other year, I can get an exam at that $20 copay. I can get lenses at that $20 copay. I can get my frame allowance every other year. If I wear contact lenses instead of glasses and I want to utilize a contact lens allowance, there's a $130 allowance for contact lenses. I cannot use both the frame allowance and the contact lens allowance in the same year. So what a lot of people do is they'll kind of switch off every other year for that contact lens allowance versus the frame allowance. Does that make sense? All right. Moving forward. Buehler provides everyone, regardless of what coverage you're in. If you waive every other coverage, you're still going to get this benefit. It's basic life and accidental death and dismemberment, or AD&D. It's a $25,000 basic life policy. So the AD&D portion of that is, if I were to pass away due to the event of an accident, it would pay a $25,000 basic life benefit and a $25,000 accidental death benefit to your beneficiary. Make sure that you're updating beneficiaries. When you're going through your elections in Paycom, there's going to be an opportunity to update those beneficiaries. Make sure that they're up to date. I can't tell you how many times I've seen an ex-spouse or an ex-girlfriend get the benefit. If you don't want to go into that person, make sure it's updated. You can do that anytime throughout the year. We know everyone's circumstances change throughout the year. If you do need to change your beneficiary, get with your manager, supervisor, Amy Sample. She can update that for you. We want to make sure that if something happens due to unfortunate events, that the money for that basic life is going to the right person. Supplemental insurance on that page is offered through Colonial. So there's a list of these supplemental coverages that are offered. There's disability insurance, that's insurance for your paycheck. There's additional term life that you can purchase on top of what Buehler provides you. Universal life, whole life, those are all insurances for life. And then your accidental coverage. So those are things that will actually pay you for doctor's visits. Depending on the service that you're getting, there's a listed amount based off of the schedule that they'll pay out. Just arbitrarily listing a number, let's say I break my leg, they'll give me, if I submit that claim, all the expenses, they'll give me like a $900 check back, or whatever amount is listed on that schedule of benefits, they're going to actually pay to your pocket to help pay for those medical expenses. It's your money. It's coming directly to you. If you don't want to use it for your medical expenses, you don't have to. If you get $900 from whatever service you get and you want to go fly to Alaska, you can go fly to Alaska. It's your money. It's in your pocket, but it's meant to supplement some of those medical expenses, so help you pay for those. There's also cancer coverage, critical illness, and medical bridge insurance. Amy Sample or one of your supervisors has the information for the Colonial rep, so they can get you in contact with them. They're going to be super knowledgeable on all the products that are listed here. Make sure that you're getting what you need to get as far as like disability, things like that go. So those plans are very customizable. So you can actually talk with them. If you only need, $200 a week, if you're disabled, just to kind of supplement some of the other expenses that you have coming in. You can really customize those benefits. Any questions over that? All right. Last thing, on the very, very back, the last page, which is page 24. It's very, very back. This is a list of important numbers and websites. So you heard me mention several times about mycigna.com. If you have not already registered and created a login, make sure that you're doing that. It will keep you up to date on how much deductible you've met, how much out-of-pocket you've met. Make sure they're billing you properly. You can use the Find a Provider service for your medical, dental, and vision coverages. Make sure that you're utilizing in-network providers. That website's listed there for you. It should also be on your ID card. And there's also your member services number. It's listed there. There is different member service numbers for the medical, dental, and vision coverages. Even though they're all through Cigna, the medical, dental is the same member services number, but the vision is going to be a little bit different. And then you have your Colonial, as well as your health savings account and the flexible spending account. So that's nice to have all in one place. I believe we can send this. I know we can, but I believe it will be sent out to you electronically. If for some reason it's not and you want a copy of this electronically, let someone know. We can get that over to you. And like I said, if you want to see the full benefit summaries, we can certainly get that over to you as well. Is there any questions over that? I know it's a lot to take in, especially this early in the morning. But any questions over any of those? All right, awesome. Well, thank you guys for your time. I'll stick around for a little bit.
Day?
Say that again.
What's the last day we can?
The 28th. And so on Monday, you should be seeing an email come through with the Paycom link and how to make your elections and all that stuff.
All right. Thank you.
Thank you.